Hello and welcome to this Fort Wayne Fire Department short. In this short we are going to cover croup, otherwise known as laryngotracheobronchitis. Croup is going to be the leading cause of airway obstruction in pediatrics 6 months to 3 years, and so it's very important we hit this topic and cover it and know it well. So what's going on? Well, as the name suggests, we have inflammation in the larynx, the trachea, and the bronchus. Before I dug deeper into this, I didn't realize that. I thought it was mostly the larynx. No, that's not the case, which is why I think a lot of people confuse this with epiglottitis because it is broader than people realize. So this is going to cover inflammation anywhere in this region here. So we have our larynx, trachea, and the portions of the bronchus. They're going to be inflamed due to a viral infection, typically the parainfluenza 1 and 2 virus. Now, it doesn't have to be a viral, it can be bacterial, but most cases it is a viral infection. And again, that is going to be that parainfluenza virus 1 and 2. What is it going to present as? These patients are going to have inspiratory stridor, as well as a hoarse sounding voice and a seal-like barking cough, for lack of a better term. It's very telltale and it's pretty unmistakable, I would say. These individuals are going to have a low-grade fever, congestion, sinus congestion, as well as body aches, basically cold-like symptoms. And what are we going to do for these individuals? Well, these individuals are going to be short of breath to some degree depending on the progression of the illness. So we're going to provide respiratory support, supplemental oxygen, as well as ventilatory support if needed with CPAP depending on the size and age of the child, or assistance with a bag valve mask. As well as something that seems to help a lot of these individuals is humidified saline. That is nebulized. So blow-by saline that is nebulized is typically fairly helpful, particularly if it's cold. You taking these individuals out in the cold nighttime air will a lot of times assist with their shortness of breath. What's going on there is you have isolated acute vasoconstriction in an area that is inflamed, and that's what's going on to help that. So hopefully this video was informative and you learned a little bit more about croup.